Let's dive right in. Question 1. A client with suspected Addison's disease has hyperpigmentation and severe fatigue. Which additional finding most strongly supports this diagnosis? A. Hypernatremia. B. Bradycardia. C. Hyponatremia. D. Increased blood pressure. Correct answer, C. Hyponatremia. Rationale: Addison's disease causes low aldosterone sodium loss hyponatremia. Strategy: Addison equals low and slow low sodium, low BP, low glucose. Question 2. A client taking lithium reports nausea, tremors, and diarrhea. Which finding confirms toxicity? A. Lithium 0.8 milliequivalent/L. B. Sodium 150 milliequivalent/L. C. Lithium 1.9 milliequivalent/L. D. Potassium 4.0 milliequivalent/L. Correct answer, C. Lithium 1.9 milliequivalent/L. Rationale: toxicity occurs when lithium greater than 1.5 milliequivalent/L GI plus neurosymptoms appear early. Strategy: lithium toxicity equals nausea, tremors, neurochanges. Question 3. A client receiving 4 vancomycin suddenly develops flushing and hypotension. What should the nurse do first? A. Stop the infusion. B. Slow the infusion rate. C. Administer epinephrine. D. Check the trough level. Correct answer, B. Slow the infusion rate. Rationale: this is red man syndrome caused by rapid infusion, not an allergy. Strategy: red man equals slow the van. Question 4. A client on warfarin has an INR of 6.4. What is the priority action? A. Stop warfarin and give vitamin K. B. Continue the dose. C. Increase dietary vitamin K. D. Hold dose and recheck INR in 24 hours. Correct answer, A. Stop warfarin and give vitamin K. Rationale: INR 6 equals severe risk for hemorrhage. Strategy: high INR equals hold plus antidote. Question 5. Which client should not receive propranolol? A. Client with hypertension. B. Client with migraines. C. Client with asthma. D. Client with tachycardia. Correct answer, C. Client with asthma. Rationale: non-selective beta blockers can cause bronchospasm. Strategy: propranolol equals problem for asthma. Question 6. A client taking digoxin reports nausea and yellow vision. Which finding supports digoxin toxicity? A. Digoxin level 0.9 nanograms per milliliter. B. Potassium 5.0 milliequivalent/L. C. Digoxin level 2.5 nanograms per milliliter. D. Sodium 140 milliequivalent/L. Correct answer, C. Digoxin level 2.5 nanograms per milliliter. Rationale: toxic when greater than 2.0 nanograms per milliliter. Strategy: GI plus vision changes equals digoxin toxicity. Question 7. A client taking furosemide reports muscle weakness and cramps. Which lab would the nurse expect? A. Potassium 2.8 milliequivalent/L. B. Potassium 4.0 milliequivalent/L. C. Sodium 150 milliequivalent/L. D. Calcium 11 milligrams per deciliter. Correct answer, A. Potassium 2.8 milliequivalent/L. Rationale: loop diuretics cause potassium loss. Strategy: loop equals lose potassium. Question 8. A client prescribed nitroglycerin should avoid which medication? A. Metformin. B. Metoprolol. C. Sildenafil. D. Aspirin. Correct answer, C. Sildenafil. Rationale: causes life-threatening hypotension. Strategy: nitro plus sildenafil equals NO. Question 9. A client taking phenytoin develops gum overgrowth. What teaching is essential? A. Stop the medication. B. Perform good oral hygiene. C. Increase vitamin K intake. D. Limit brushing. Correct answer, B. Perform good oral hygiene. Rationale: gingival hyperplasia prevented by brushing/flossing. Strategy: Phenytoin equals puffy gums. Question 10. A client taking long-term prednisone is at greatest risk for which complication? A. Hypoglycemia. B. Infection. C. Weight loss. D. Low blood pressure. Correct answer: B. Infection. Rationale: steroids suppress the immune system. Strategy: prednisone equals prone to infection. Question 11. A client taking an ACE inhibitor develops a persistent dry cough. What is the appropriate action? A. Increase the dose. B. Switch to an ARB. C. Stop all antihypertensives. D. Give cough syrup. Correct answer: B. Switch to an ARB. Rationale: ACE inhibitors commonly cause cough, ARBs do not. Strategy: ACE cough ARB. Question 12. A client taking Rifampin notices orange urine. What should the nurse do? A. Stop the drug. B. Notify the provider. C. Reassure the client. D. Check kidney function. Correct answer: C. Reassure the client. Rationale: orange secretions are expected. Strategy: Rifampin equals red-orange. Question 13. Which electrolyte imbalance is expected with spironolactone use? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypercalcemia. Correct answer: B. Hyperkalemia. Rationale: potassium-sparing diuretic. Strategy: spironolactone equals spares potassium. Question 14. A client on isoniazid reports numbness and tingling in the hands. Which supplement prevents this? A. Vitamin K. B. Vitamin B6. C. Vitamin B12. D. Folate. Correct answer: B. Vitamin B6. Rationale: prevents neuropathy caused by INH. Strategy: INH equals I need B6. Question 15. A client taking metformin is scheduled for a CT scan with contrast. What should the nurse do? A. Give the medication. B. Hold the medication. C. Increase fluid restriction. D. Administer insulin instead. Correct answer: B. Hold the medication. Rationale: risk of lactic acidosis with contrast dye. Strategy: contrast. Hold metformin. Question 16. A client taking clopidogrel after stent placement should avoid which item? A. Milk. B. Grapefruit juice. C. Whole grains. D. Bananas. Correct answer: B. Grapefruit juice. Rationale: grapefruit inhibits metabolism, increasing bleeding risk. Strategy: many cardiac meds equals avoid grapefruit. Question 17. A client on heparin has a platelet count of 48,000. What should the nurse do? A. Continue infusion. B. Increase heparin rate. C. Stop heparin immediately. D. Administer warfarin. Correct answer: C. Stop heparin immediately. Rationale: platelets less than 50,000 suggests hit. Strategy: heparin plus low platelets equals stop. Question 18. Which client should avoid NSAIDs? A. Client with migraines. B. Client with fever. C. Client with renal failure. D. Client with arthritis. Correct answer: C. Client with renal failure. Rationale: NSAIDs decrease renal perfusion. Strategy: NSAIDs equals NO kidneys. Question 19. A client taking amiodarone needs monitoring for which condition? A. Hyperglycemia. B. Thyroid dysfunction. C. High potassium. D. Low sodium. Correct answer: B. Thyroid dysfunction. Rationale: amiodarone alters thyroid hormones. Strategy: amiodarone equals check thyroid. Question 20. A client taking gentamicin reports ringing in the ears. This finding indicates A. Nephrotoxicity. B. Hepatotoxicity. C. Ototoxicity. D. Cardiotoxicity. Correct answer, C. Ototoxicity. Rationale, aminoglycosides damage hearing. Strategy, gentamicin equals ears plus kidneys. Question 21. Which instruction is essential for a client taking tetracycline? A. Take with milk. B. Avoid sun exposure. C. Take at bedtime. D. Take with antacids. Correct answer, B. Avoid sun exposure. Rationale, tetracyclines cause photosensitivity. Strategy, tetracycline equals sunburn easily. Question 22. A client taking MAOIs should avoid which food? A. Yogurt. B. Fresh fruit. C. Aged cheese. D. Rice. Correct answer, C. Aged cheese. Rationale, tyramine foods hypertensive crisis. Strategy, MAOI equals avoid aged foods. Question 23. What is the priority lab to check before administering potassium chloride for? A. Sodium. B. Calcium. C. Urine output. D. Hemoglobin. Correct answer, C. Urine output. Rationale, must be greater than 30 milliliters per hour to prevent hyperkalemia. Strategy, no P equals no K. Question 24. A client on statins develops muscle pain. Which lab should be checked? A. Potassium. B. CK level. C. WBC count. D. Hematocrit. Correct answer, B. CK level. Rationale, elevated CK equals rhabdomyolysis risk. Strategy, statins equals check muscles. Question 25. Which finding indicates albuterol is working effectively? A. Decreased heart rate. B. Clear breath sounds. C. Decreased urine output. D. Slowed respiratory rate. Correct answer, B. Clear breath sounds. Rationale, albuterol relieves bronchospasm. Strategy, albuterol equals airway opens. Question 26. A client on morphine has shallow respirations of 8 per minute. What is the priority? A. Reposition the client. B. Give naloxone. C. Increase 4 fluids. D. Notify the provider. Correct answer, B. Give naloxone. Rationale, respiratory depression equals antidote. Strategy, morphine emergency equals naloxone. Question 27. A client starting levothyroxine should be taught. A. Take with food. B. Expect weight gain. C. Take in the morning on empty stomach. D. Stop if palpitations occur. Correct answer, C. Take in the morning on empty stomach. Rationale, absorption best on empty stomach. Strategy, thyroid meds equals AM plus empty stomach. Question 28. A client on ACE inhibitors develops swelling of lips and tongue. What is the priority? A. Administer diphenhydramine. B. Hold the next dose. C. Provide oxygen. D. Prepare for intubation. Correct answer, D. Prepare for intubation. Rationale, angioedema can obstruct airway. Strategy, ACE plus swelling equals emergency airway. Question 29. Which lab indicates metformin should be discontinued? A. Potassium 4.2. B. Creatinine 3.0. C. Sodium 138. D. Glucose 140. Correct answer, B. Creatinine 3.0. Rationale, metformin contraindicated in renal failure. Strategy, high creatinine equals no metformin. Question 30. A client on methotrexate reports mouth ulcers. What should the nurse do? A. Stop the drug. B. Encourage oral care. C. Increase dose. D. Give vitamin C. Correct answer, B. Encourage oral care. Rationale, stomatitis is common side effect. Strategy, methotrexate equals monitor mouth. Question 31. Which symptom indicates too much levothyroxine? A. Weight gain. B. Cold intolerance. C. Bradycardia. D. Tachycardia. Correct answer, D. Tachycardia. Rationale, excess thyroid hormone increases metabolism. Strategy, too much thyroid equals speed up. Question 32. A client on cyclosporin should avoid A. Milk. B. Beer. C. Grapefruit juice. D. Coffee. Correct answer, C. Grapefruit juice. Rationale, increases drug levels toxicity. Strategy, immunosuppressants plus grapefruit equals danger. Question 33. Which finding in a client taking furosemide is most concerning? A. Weight loss. B. BP 9860. C. Tinnitus. D. Mild dehydration. Correct answer, C. Tinnitus. Rationale, indicates ototoxicity. Strategy, loop diuretics equals ear risk. Question 34. A client on insulin becomes sweaty and confused. The priority action is A. Check blood sugar. B. Give glucagon. C. Notify provider. D. Give insulin. Correct answer, A. Check blood sugar. Rationale, must confirm hypoglycemia. Strategy, hypoglycemia? Check glucose first. Question 35. A client taking amoxicillin develops wheezing and hives. What is the priority? A. Give epinephrine. B. Provide oxygen. C. Stop the medication. D. Administer steroids. Correct answer, A. Give epinephrine. Rationale, anaphylaxis equals epinephrine first. Strategy, AP first, always. Question 36. Which food should be avoided when taking potassium-sparing diuretics? A. Apples. B. Watermelon. C. Bananas. D. Rice. Correct answer, C. Bananas. Rationale, high potassium foods hyperkalemia. Strategy, spironolactone avoid potassium foods. Question 37. A client on nitroprusside shows BP 80/40. What should the nurse do? A. Increase infusion. B. Stop the infusion. C. Give more fluids. D. Notify provider only. Correct answer, B. Stop the infusion. Rationale, causes rapid, dangerous hypotension. Strategy, nitroprusside equals watch BP closely. Question 38. Which lab must be monitored with vancomycin therapy? A. TSH. B. INR. C. Trough level. D. ALT. Correct answer, C. Trough level. Rationale, ensures therapeutic, not toxic levels. Strategy, vancomycin equals check trough. Question 39. A client on iron supplements needs which instruction? A. Take with milk. B. Expect black stools. C. Take with antacids. D. Crush tablets. Correct answer, B. Expect black stools. Rationale, normal harmless effect. Strategy, iron equals dark stools. Question 40. A client taking SSRIs is at risk for which condition when combined with St. John's wort? A. Neuroleptic syndrome. B. Serotonin syndrome. C. Thyroid storm. D. Hypertensive crisis. Correct answer, B. Serotonin syndrome. Rationale, increases serotonin excessively. Strategy, SSRI plus herbal equals risky. Question 41. A client prescribed hydralazine shows HR 140 and BP 160/98. This reaction is likely due to A. Fluid overload. B. Reflex tachycardia. C. Dehydration. D. Drug toxicity. Correct answer, B. Reflex tachycardia. Rationale, hydralazine vasodilates HR rises. Strategy, vasodilators HR compensation. Question 42. A client taking opioids reports constipation. Best intervention is A. Decrease fluid intake. B. Add fiber to diet. C. Stop opioids. D. Reduce activity. Correct answer, B. Add fiber to diet. Rationale, opioids slow GI motility. Strategy, opioids equals constipation care. Question 43. A client on warfarin asks which foods to avoid. The nurse responds. A. Citrus fruits. B. Broccoli. C. Pasta. D. Chicken. Correct answer, B. Broccoli. Rationale, high in vitamin K. Strategy, warfarin equals consistent vitamin K. Question 44. Before giving propranolol, the nurse must check. A. Blood sugar. B. Respiratory status. C. Calcium level. D. Weight. Correct answer, B. Respiratory status. Rationale, can cause bronchospasm. Strategy, non-selective beta blocker equals lungs. Question 45. A client on clozapine reports sore throat and fever. Priority action? A. Give acetaminophen. B. Encourage fluids. C. Check WBC count. D. Hold next dose. Correct answer, C. Check WBC count. Rationale, risk of agranulocytosis. Strategy, clozapine equals check WBC. Question 46. A client taking metoprolol has a HR of 48. What should the nurse do? A. Give medication. B. Hold dose. C. Double dose. D. Give fluids. Correct answer, B. Hold dose. Rationale, beta blockers slow HR. Strategy, HR less than 50 equals hold beta blockers. Question 47. A client on nifedipine develops peripheral edema. This effect is due to A. Heart failure. B. Fluid overload. C. Vasodilation side effect. D. Kidney dysfunction. Correct answer, C. Vasodilation side effect. Rationale, calcium channel blockers commonly cause edema. Strategy, CCB equals swollen ankles. Question 48. A client on oxytocin develops late decelerations. What is the priority? A. Stop oxytocin. B. Increase infusion. C. Start pushing. D. Check dilation. Correct answer, A. Stop oxytocin. Rationale, late decels equals uteroplacental insufficiency. Strategy, oxytocin emergency equals stop first. Question 49. A client on insulin glargine asks when to take it. The nurse responds. A. Before meals. B. After meals. C. At bedtime. D. With snacks. Correct answer, C. At bedtime. Rationale, long-acting, stable overnight coverage. Strategy, glargine equals daily, same time. Question 50. A client taking allopurinol should be instructed to A. Take with dairy. B. Increase fluid intake. C. Avoid fluids. D. Take with antacids. Correct answer, B. Increase fluid intake. Rationale, helps prevent kidney stones. Strategy, allopurinol equals flush kidneys. Thank you so much for studying with me today. If you made it all the way to the end, you're already ahead of most learners. This level of consistency is exactly what leads to NCLEX success. Before you go, do these 3 things. Like this video so more nursing students can find it. Subscribe for daily high-yield NCLEX practice. Turn on notifications so you never miss new questions, rationales, and strategies. Remember, you don't fail the NCLEX because it's hard, you fail when you don't practice. And you practice today. See you in the next one. Keep pushing. Keep learning. Keep winning.